Okay, so these are the lower uh, blood vessels in the pig that we need you to know. First of all, remember that all of these connective tissues in around the intestines are blood vessels, or a lot of it is. And so this whole thing, the mesentery, is considered an organ now. But what I need you to do is pull it to the side and don't pull it out. But you're going to use your blunt probe and look for the lumps and trace out the kidney. And then you're going to use your blunt probe to trace around all of these pieces of the blood vessels because there's a lot of soft connective tissue in between them. The best way to do that is to trace the descending aorta. Now, please be aware that you have to be a little bit careful with the rectum above that. Push it to the side gently with the probe and try not to nick it because that would be bad. Okay, so we have our kidney, and the kidney is a nice place to start because that'll give you the correct depth for where to look for the descending aorta and the inferior vena cava. So you look at and be careful about the kidney because like poking yourself or poking into it, it's very easily damaged. So you have to work around and trace around it and remove that membrane, and it'll just kind of peel off. But you're looking for this blood vessel in between here, in the medial of the kidney. The first one, both of them are kind of confusing because they're both a little bit bluish, but this larger one that's flat and flexible that goes over and connects to this vena cava here is the one that is the left renal artery. And so you're going to look and trace that out. Usually we can't see the adrenal gland that well. There's a little bit of it here in the circle, but it gets destroyed pretty easily when you're doing the dissection through the membrane. So we have we'll trace this out with our blunt probe and find the descending aorta, and then this branch that connects in towards the middle of the kidney. And there's three things that come into the kidney. Here's the ureter that collects all the urine and brings it down to the bladder. We have this branch right off the descending aorta. That's the renal artery. And this is the left renal artery. And then we have the left renal vein. So they kind of make a triangle. So you can start cleaning that out in that way. You can clean anteriorly and posteriorly. Anterior is a little bit more difficult, so you have to be careful with it. But just anterior of the renal vein on the left side, you can see this mass coming out right here. And I've cleaned out a lot of membrane on it, so you got to be careful with this. But it would come straight out at you ventrally from the descending aorta, and this is the mesenteric artery, the anterior mesenteric artery. There's a posterior one, but it's very easily damaged over here. So the anterior one is pretty thick. It goes all into this set of the intestines and mesentery, and that's why it's called that. So if you go a little bit farther up from here, you have a number of blood vessels, one of which is coming into the spleen and the stomach. And that's a gastrosplenic artery. You can also see part of it up here with the connection about medial of the spleen, okay? And it kind of holds it all around the midline of the stomach. Now, we need to trace where this vein is, the renal vein is, so we're going to flip this over and trace out the other side as well. And I've already done that for you. So we have the inferior or caudal vena cava, and this goes up to connect through the hepatic portal vein. The hepatic portal vein is difficult to see in this one, but it'll go up and meet and fuse with the superior vena cava just outside of the right atrium. But you can see where the left renal artery comes in and connects to that. And we have the left renal vein coming in, or sorry, the right renal vein here, connecting to it. And so we're looking for that triangle, and underneath we can see that this is the right renal artery, and it connects to the inferior or descending aorta. So this, you can tell the difference in connective tissue and stuff, and such, between the inferior vena cava and the descending aorta. But please note that there is also a ureter here. Now, let's go back to the left side and follow and clear out some of the connective tissue. You can see the inferior, the posterior mesenteric artery. A lot of the times this gets destroyed, so I don't usually test on that. But we have it ending in a bunch of branches here. There's really 4. 1, 2, 3, 4. So the outer 2 are the iliac arteries. The iliac arteries go to either leg and in this quarter, really. You follow it and there's a first branch. And people think this is a femoral, so it isn't. It's the deep circumflex artery. And it looks pretty small here. But you go a little bit farther up and you see these 2 main branches. We have the external and deep femoral arteries. And those are the ones that we usually need to clamp down on in humans with some sort of tourniquet in case there's a major leg injury. So either one, I'll accept femoral artery. One's the deep, and here's the external femoral artery. And it's the same thing on the other side, except this is the left. Okay, so if I point to this section in between the femoral arteries and the deep circumflex, all of this is iliac artery. Now the second branch, and it's mirrored on the other side, that's the left umbilical artery, and you can see it goes up and all the way to the umbilical cord on the outside. And here's the right umbilical artery, and in between is the bladder. And you can see that the ureters from both kidneys come in and feed into this bladder here. That is all you need to know about the blood vessels of the lower peritoneal membrane.